Welcome back to Body Beautiful. We'll be taking your calls with any questions you might have about mommy makeovers. The phone number, 800-440-4884. And again, we'll be putting the number for the doctor's office during and at the end of the segment. And remember, any advice we give you today, you certainly want a second opinion. We'll take your calls about mommy makeovers, but really we've been talking about gynecomastia surgery. Tell me what that is. It's man breasts, right?
Exactly, that's right. It's when men develop a feminine-looking chest or breasts. And obviously, for a man to have that, it's very emotionally hard, very embarrassed. They can't wear a tight T-shirt without looking or appearing not quite right. They can't go to the beach. So it really does cause a lot of emotional distress.
You know, we've been hearing more and more about teenage boys getting this, and that has definitely got to be difficult for them in gym class, and you know the amount of razzing that kids get anyway. So how young is too young to have this surgery?
Yeah, it's, you know, I have been seeing more and more younger men, and certainly even some teenagers, and that was unusual 5-10 years ago. So when I see teenagers, they usually come in with their parents, and they've been obviously having a lot of emotional issues. A lot of times it takes a year or two even for the parents to realize that the teenager is having these issues, and most of them do have they go to the pediatrician and get their okay from the pediatrician before I actually am willing to treat them.
Is this hormonal?
It's a combination of hormonal and genetics. Some of the teenagers are actually overweight, and if they're overweight, the chest area can be primarily fat and a little bit of gland.
We've actually got some pictures to show folks, so let's go ahead and roll those while you're talking.
And then some of them can actually be primarily gland, and that's genetics. It's the way the gland is developing. It's for whatever reason more sensitive to the little bit of estrogen they have circulating in their system, and so they develop larger breasts.
Now, we're not seeing any scarring, anything? It just...
Yeah, so, you know, it actually heals. There's a tiny scar underneath the chest, and there's another little scar underneath the nipple. Both these scars heal very well, and that's the best part about this procedure. It's a very fast, quick, like this young man has the typical gynecomastia. He's got a little bit of fatty tissue and a little bit of gland found underneath the nipple and areola. So I do something called ultrasonic liposuction to break down the fat and then make an incision underneath the nipple and remove the gland.
And that will grow back, right?
And it doesn't grow back.
Okay.
It really doesn't grow back.
We have a little bit of time here. Let's go ahead and try to take some of these calls. Linda from Concord, good morning. Do you have a question for the doctor?
Yeah, hi, how are you?
Hi.
First of all, this is a wonderful show. I am very impressed by it.
Thanks.
Now, the question I have for the doctor, because I have been looking for a plastic surgeon, is how many tummy tucks can you have safely?
I guess the first question would be, how many are you done having children, right?
Yes.
Oh, yeah.
Okay.
So if you're done having children, have you had a tummy tuck in the past?
2.
You've had 2 in the past. So from the safety standpoint, you can safely have another tummy tuck, but it really depends on, do you really need a full tummy tuck or do you need a partial tummy tuck? It depends on how much skin you have right now, whether you can actually have a full tummy tuck. Each time you're going to have surgery, you do have a little more scar tissue, and this actual surgery can be a little more technically challenging.
Carol, can I butt in for a second? Do you also sometimes recommend just I mean, obviously you have to see the person, but maybe just a little lipo, or is there lasering or something else that can be done?
Yeah, so it depends. If it's primarily a little bit of fatty tissue, then all you may need is some liposuction. But if it really is a large amount of skin again, then you actually may need a tummy tuck. Again, if the skin is primarily below the belly button, you may just need the mini. Or if it's above the belly button, we have to see how much skin you have, whether we can even do another tummy tuck.
But again, that's why I'm just curious. I mean, after 2, there comes a point in which you really don't want to be taking any more skin or muscle
you
for
don't,
health reasons?
Not really. No. So as long as their general health is good, they're in good health, the doctor says it's okay, their primary care says it's okay to have the surgery can be done depending on the anatomy, depending on how much skin they have, how much loose skin they have, depending on how many stretch marks they have, or whether we can even remove the skin, or whether it's primarily only fatty tissue.
Is it age too? I mean, is that important too?
More for the general health. Okay. You know, you can have a 30-year-old who physiologically a 60-year-old, then she's not a good candidate, or vice versa.
Fascinating topics. Unfortunately, we are out of time. Dr. Rajagopal, thank you so much for joining us. For more information about Dr. Rajagopal, you can call her at 415-392-3333 or check her out on the web at sfcosmeticsurgery.com.